In today's episode, we're talking about a really simple thing that you can do today to improve your mental health, which is mindful eating. And if you want to learn more about how to improve your mental health, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and I'm the founder of Pacific Integrative Psychiatry. We're an online mental health practice in California. We see adults with anxiety, depression, and sleep issues, and we also provide nutrition services for mental health.
And I'm Ailar Poormoghaddam. I'm a certified clinical nutritionist and functional medicine provider at Pacific Integrative Psychiatry, and I specialize in nutrition for mental health.
Great. So I am excited to talk today about mindful eating. I think this is something that a lot of people have probably heard of, but they might not know a lot about how to practice it or what the far-reaching impacts are, because it does have a lot of benefits. And we can also talk a little bit about our own experiences with mindful eating, because I know for me, it does actually make a big difference. So Ailar, can you share what is mindful eating? What are we talking about when we use that term?
Yeah, so mindful eating really connects the mind and the body and our experience with food. So one principle that's really important for mindful eating is eating without judgment. And a lot of times we can be our own harshest critic. So not judging ourselves for the choices we make, the decisions we make when it comes to eating is a really big part of mindful eating. It also takes into account all of our senses. So not just tasting the food, but seeing it, smelling it. If there's something crunchy, really hearing that sound as you're eating the food. You also want to be intentional when it comes to your food choices. So being mindful about what you're choosing and is it serving you well, physically and also mentally. And then while you're eating the food, really trying to be present in that moment with your food, avoiding distractions, eating quickly, which I know a lot of us can do. So really being in that present moment and being mindful of the food that you're eating and also the experience that you're having with it.
I like how you first mentioned the non-judgment aspect of it. Can you share more? Like, what do you mean by that?
Yeah. So, a lot of times I'll hear from my clients, oh, I was doing so good. And then I had a bagel or I had a donut. So just really experiencing that donut as you're eating it is so much different than as you're about to start eating it, just really judging yourself, thinking negative thoughts, really not wanting to eat it before you even eat it, right? Or thinking about all the negative things that might come afterwards, feelings of guilt that a lot of people experience when it comes to eating sweets and sugars. So non-judgmentally eating that donut and having an experience with it is so different and really hard to do for most of us versus, judging yourself just as you would with a friend, right? A friend that you have compassion for and saying, hey, it's okay. You've been eating healthy 5 days a week. You can enjoy this donut today and just really not being judgmental towards yourself.
Yeah. And I think the judgment piece also takes the enjoyment out of it, like you said. And even the words that we use about food, like, oh, it's a guilty pleasure, or this is unhealthy versus healthy, or this is my cheat day, this is my cheat food. All of those can create those negative judgments and negative associations with the food. And in Ayurveda, which is the ancient system of medicine and healing from India, they say to take your food with confidence. So whatever you're eating, enjoy it. Like you said, pay attention to the flavors and the textures and the smells and everything and the tastes, and really take it with confidence and enjoy it no matter what it is, whether it's quote unquote healthy or unhealthy.
Yeah, absolutely. And I love what you said. It's those negative thoughts, the words that we associate with the food and how we expect it to make us feel. But labeling foods as healthy versus unhealthy versus thinking, how is this serving my body in the present moment as you're experiencing it is so much different. So a lot of times the guilt feeling is what triggers a lot of the afterward symptoms or abdominal pain or, mental health symptoms that we get after eating something, like feeling fatigued and tired. It might be because of the way you were judging that food or the thoughts you were having about it before you even ate it.
That's really interesting. So when it comes to mindful eating, one of the other benefits, in addition to digestion, which we'll talk about in a moment, is the impact it has on mental health and specifically anxiety. So how does mindful eating actually impact stress levels and anxiety?
Yeah. So, the first thing we talked about is that mind body connection. And when you take the time to be mindful about what you're eating, really paying attention to the choice that you're making, the decision that you're making, and how it serves your body, it eliminates a lot of choices that we make out of boredom or out of being stressed, right? So if you're already feeling stressed and anxious, and then you reach for something that is sugary, rich in carbohydrates, which tend to be more comfort foods for people, it can worsen that anxiety and it can worsen the stress. It can give you temporary relief and make you happy briefly, but then it can worsen that feeling. So being more mindful of that decision can help reduce the anxiety actually more than eating out of stress or eating out of boredom. It also allows us to slow down while we eat, so that transition from taking your body from the fight or flight mode into the parasympathetic nervous system, which is really necessary for the digestive system to work properly. And it can allow us to really feel more relaxed and enjoy the food that we're having, and actually help us become happier as a result, and maybe even less stressed and less anxious versus worsening the symptoms we're already feeling.
Wait, so if you're eating slowly versus scarfing your food down, it impacts your mental health? That's interesting, right? Yeah, and I think it is like such a simple thing, eating food, but how many of us are eating at our desk while we're, checking email or trying to catch up on work, or people are eating in their cars, or just eating on the go, standing up, not even sitting down when they're eating. I think that's such a common thing that a lot of us end up doing because we're so busy. And so taking that time out just to sit down and enjoy our food, it has a ritualistic aspect to it. But it also, like you said, it helps to calm our nervous system, which also impacts sleep. And we're going to be talking about sleep and nutrition in one of our upcoming workshops. It's April 2023. So if people are interested in that, stay tuned. But it has so many far-reaching effects. What about digestion? How does mindful eating help with digestion?
Yeah, so that transition from the sympathetic to parasympathetic nervous system is one of the most important ways that we can help our digestive system work properly when we eat. When we're being mindful and practicing mindful eating, it can help us eat more slowly versus, like you said, if we're sitting at our workstation or if we're rushed or eating while standing up, it causes us to eat more quickly. Plus, it doesn't allow us to chew our food more thoroughly. So the less digestion that occurs in our mouth, the more digestion that has to occur further down in the digestive tract. And this can trigger a lot of symptoms for people like bloating, abdominal pain, right? Feelings of heartburn, acid reflux, which tend to come from eating quickly, and also overeating. So eating when we're already full. And when we eat quickly, we don't really allow the digestive system to signal the brain and tell us, hey, I'm full, but we're just eating because we're in a rush, right? And we want to finish the entire bowl or the entire food that we have in front of us before we have to move on to the next activity. So really sitting down, enjoying the food that we're eating, but also eating it in a relaxed state, it can allow the digestive system to work properly.
Yeah. And so as you mentioned, that the parasympathetic versus the sympathetic parts of the autonomic nervous system, the parasympathetic nervous system is known as the rest and digest function of the nervous system, whereas sympathetic is the fight, flight, and freeze response. So if we're in the fight and flight and freeze response, then our rest and digest can't work. They can't both work at the same time, right? So mindful eating is helping to activate that parasympathetic nervous system, which is required for digestion. How long does it take for your gut to signal to the brain that you're full?
Yeah, so this can vary, and it can vary depending on how fast someone's digestive system might work or your metabolism. But the signals, I would say it can take about 5 to 10 minutes around. Sometimes it can take up to 15 minutes, but not a lot of us allow our bodies, even just about 2 minutes or even 3 minutes to signal the brain and, okay, I'm full, right? Some people might put down their fork, they might sit back and then go back to eating more. And I think that's a really good practice in checking in with your body to make sure that you're eating or not overeating past the point of being full, which can trigger, again, heartburn, acid reflux. But just giving your body at least just a few minutes and starting, with maybe just a couple minutes minutes at a time. And then later on, you may even move up to 5-10 minutes before going back and getting a second plate, and knowing that that's always an option, right? You don't have to finish everything that's in front of you, or you don't have to just get one serving. You can go back into the kitchen and get more if you feel like you're still hungry.
Yeah. And I think for a lot of us, it's undoing things that we may have learned growing up, like, being a member of the Clean Plate Club, like you have to eat everything that's on your plate or eat every grain of rice that's on your plate. I think that was indoctrinated into many of us when we were growing up. And so part of mindful eating is undoing some of these patterns and really listening to your body and tuning into yourself to see what you actually need versus eating a prescribed amount of food that you think you should be eating, but that you might not actually need.
Mm-hmm. Yeah, especially, a lot of us that tend to have long gaps between our meals. I know that for a lot of people can trigger you to think you have to eat a lot more than you actually might need in that moment. So you want to eat twice the portion size that you would have initially eaten, because now it's been 5-6 hours since that last meal versus just about 4 hours is when a lot of people start to feel hungry from their last meal.
Yeah, so it's really powerful, practicing these different aspects of mindful eating. And one of my patients comes to mind who I used to work with, and he struggled a lot with gas and bloating after his meals. And one of the recommendations I gave to him was just sit when you're done eating, just sit and wait for 5 minutes before you get up. And this is something that helps me a lot too, because I sometimes do tend to rush and, I'm still chewing as I'm putting my plate away. So just practicing sitting there for a few minutes when you're done, like put your utensils down and just sit and enjoy, right? And just let your digestive system do its thing. And so he started doing that, and the gas and bloating improved significantly just by that one practice alone.
Yeah. I've heard a lot of similar experiences with patients, and especially when you really analyze their day, right? What meals are they having? How frequently are they eating? And when patients express, I have lunch as my biggest meal of the day, and I have 15 minutes to eat my lunch, right? Not a lot of providers actually take the time to understand someone's schedule, their eating habits, their portion sizes. Do they get up immediately after their meal and return to another activity that might be stressful? So it does have a lot of positive impact, and it's not just about what you're eating, but a lot of times it's about how and when you're eating.
Yeah, and I've seen some of the patients that we work with in our practice, and I've seen some of your recommendations to them and kind of following how they were when they first started, and then after they've implemented the recommendations you gave them, the impact that had, and how it really changes how they go through their day, not only what they're eating and when, but also just how they feel generally going through their day.
Yeah.
What are some of your experiences with mindful eating? Like, what do you like to practice, and how does it impact you?
Yeah. So, mindful eating is something that I've been working on, for several years. I think it's always a work in progress, and we can always use more mindful eating. I can be honest and say that it's hard to practice mindful eating with every single meal, especially during the work days, especially when we don't have a long lunch break or we don't have a lot of time to sit around. But one of the most important things that I've learned to do is really step away from the workspace, whether you're working in an office, in a clinic setting, or you're working at home, not sitting at the same place that you do your work. So wherever your laptop is, even if your laptop is at the dining table, try not to eat there, because your brain probably associates that setting with a stressful environment. And if you eat in that setting, your body can't really transition to the parasympathetic nervous system. So I try to make an effort to go sit on the couch or leave the office and go to my car or sit outside, somewhere else that my body just associates this with mealtime and not work time. Another thing that I've been trying to do more consciously is just put away distractions. So sometimes it's kind of awkward to sit there by yourself, like looking around, even if you're home by yourself, you kind of want to be like doing something else. Like, let me check my emails while I'm eating, or let me go on my phone and talk to somebody, or let me turn on a TV, or some people like to watch videos during their lunch break because we like to hear something. Our brain likes to be stimulated at the same time as we're eating. but that's a distraction that takes away from the presence of the food. We can't be mindful of it, how long we're taking to eat, how slowly are we eating and chewing. So putting away electronics, distractions in that way. And then one thing I used to practice more frequently when I first learned about mindful eating was actually eating with my non-dominant hand, which really forced me to slow down. So I would consciously try to remember, I would have a sticky note somewhere and say, okay, eat with your left hand. And I would switch. And that automatically made me slow down, even if I didn't want to, just because I'm not as well coordinated with eating with that hand. And then the last thing that I've been practicing is really trying to take just a few seconds, like 10 seconds, to just like say a prayer or show gratitude for my food and just say, wow, I'm so thankful to have this meal in front of me right now, and I can't wait to eat it. Something brief, right? And that doesn't cause you to just immediately start eating it, especially if you're coming from a stressful environment and you're immediately about to dig into your meal.
I love all of those tips. Those are great. And the gratitude one is really lovely. And that's something that we do as well. Just say a short mantra or prayer or gratitude note before starting your meal. And it forces you to slow down, right? Because you've got your plate in front of you. It's easy to grab your fork or spoon or whatever and just start digging in. But if you just take a moment to reflect on gratitude for the food that's in front of you, it's already invoking that mindfulness that's going to continue for the rest of the meal. What do you recommend as far as chewing? That old, adage of, you should chew your food 20 to 30 times. What do you think about that?
Yeah, I think it's a really great start, especially if you're someone that is having a hard time starting mindful eating practices. I think having that in mind and saying, okay, I'm going to start chewing my food at least 10 times or 15 times, and then gradually trying to increase it and seeing if over time your body just starts to do it more subconsciously. I think changing habits can be hard and it can take time. So starting with small habits, taking a small step, but then the consistency is what really helps us see progress and see change. So if your goal is to eat your lunch more mindfully, maybe saying, okay, for the first couple of bites, maybe for the first 3 or 4 bites, I'm going to count to 15 and chew my food. And then after that, being a bit more relaxed by it. I think the practice can be helpful, but what a lot of times happens is patients tend to become more stressed with the thought of like, oh no, I didn't count, or no, I didn't do that. And it can actually make you more stressed and anxious. So again, that non-judgmental feeling towards yourself and being patient with yourself, but it definitely can help, especially when you have a specific goal in mind that's achievable for you. So I think, counting 10, 15 times as a start, and then maybe working up to 20 and seeing how does it affect your digestive system and checking in with your body.
Yeah, that's really helpful. And again, that non-judgmental approach is really important because there's no right or wrong way to practice mindful eating. It's going to be different for everybody. And it's really, like we're talking about unlearning habits, it's also kind of unlearning habits that we live with in our modern society of doing things on the go, of rushing around, of being distracted, of multitasking. This goes against all of that. And it's really about going back to basics. And it can be hard to undo all of, or even to go up against all of these systems that are not conducive to living mindfully. So it's a way to really practice self-care and just carve out some time for yourself during your day. And it does have far-reaching implications on how you go through your day with other activities.
Mm-hmm. Yeah, exactly. And, just taking that moment and even realizing it, I think is such a big step, in the middle of your meal and thinking, oh, wow, I'm eating really fast. Let me slow down, and not knowing that sometimes you may forget, sometimes you might be in a rush and not even think about mindful eating. That actually just happened to me today. And I was just sitting, preparing for the next event that I had to go to. And I was eating really quickly. And I was like, okay, let me take a second. And I actually took a deep inhale through my nose. And I was like, that felt weird. Like, how often do I take a deep inhale, like through my nose while I'm eating? And it just like really relaxed my body. And it made me think, okay, am I doing this? Am I not doing this? So I really want to practice that, because when we do deep breathing, it really does put our body into a more relaxed state. And it made me realize we don't do a lot of deep breathing while we're eating. We're kind of eating really quickly, and it's hard to take deep breaths when you're constantly chewing and swallowing. So taking a deep breath every couple bites can really help.
Yeah, that's such a great reminder. And even just like taking a break between bites, take a bite, take smaller bites, maybe chew it, put your fork down, swallow it, take a breath, then move on to the next one. Again, it's like, yeah, like we're just not, our days are usually not set up for this. So we have to be intentional about it, like you said. So what are 3 tips that you would like to leave people with today for mindful eating?
Yeah. So, I think one of the first things I recommend is going back to that body check, or that checking in with yourself and seeing, okay, am I eating right now because I'm hungry, or am I eating because I feel really stressed, or I feel anxious, or am I just really bored? So it's kind of like a body scan, but more of like a check-in with your body and seeing why you're eating, because that can also change how you're eating, right? And the decisions that you make for the foods that you're going to eat. And the second thing is to serve yourself a smaller portion and then sitting down with that meal, especially if you have time to eat at home. I think this is a good practice. You have the food, whether it's on the table or in the kitchen, and you take a smaller portion size than what you originally thought you wanted, knowing that you can always go back and get more. This helps us eat, slowly, but also eat smaller portions. And it gives your body that time to check in, for the gut and the brain to talk a little bit back and forth and say, okay, I am still hungry. Let's go get more. Because that time that it takes to go from, one plate to the next does give your body a few minutes. It helps avoid, overeating, eating quickly. And then also sitting at a dining table or a place where you associate with a meal, right? So we talked about getting away from your workspace or a stressful environment, or a place that you associate with a task that typically stresses you out, and transitioning to a place where you don't do work, where you normally sit and relax. And then that can really transition your digestive system into the rest and digest mode, which is needed to properly break down the food, release the right enzymes. I always use the example of, the sympathetic nervous system is kind of like an animal being chased in the wild, right? So it's like our body is like trying to fight for itself. And think about trying to sit down and digest your food while you're thinking about your life, and when your life is in danger. And the brain, tends to shut down all the other systems, like the digestive system, the reproductive system. So it's not a priority to digest your food well when you're under stress. And think about how important that is later on down your digestive tract, when your small intestine, large intestine is trying to not only digest and break down the food, but also properly extract the nutrients. So this is one of the most important things you can do, is to find a way to transition your body into a more relaxed state, so your parasympathetic nervous system can become active.
Great. Well, that was all really, really helpful. So if people want to work with you or learn more about you, how can they find out more?
Yeah, so I'm accepting new clients at Pacific Integrative Psych. You can visit our website, or you can email us at contact@pacificintegrativepsych.com. We schedule free discovery calls so you can learn more about our practice and whether or not we're a good fit for you.
Excellent. And also, Ailar has some great reels on Instagram, so check those out. She provides so much good information about nutrition and mental health. So you can find that at Pacific Integrative Psych as well. So thanks, Ailar. This was really fun, and I learned a lot. I appreciate you sharing your knowledge.
Thank you. Thank you for having me.